The legalization of euthanasia would be a failure of society and the government to protect its members from killing legally. There are 4 reasons why I believe that we should not legalize euthanasia or physician-assisted suicide in Indiana. The first one being alternative treatments are available. Alternative treatments are available, such as palliative care and hospices. We do not have to kill the patient to kill the symptoms. Nearly all pain can be relieved. The second reason is there's no right to be killed. Opening the doors to voluntary euthanasia and assisted suicide could lead to non-voluntary and involuntary euthanasia by giving doctors the power to decide when a patient's life is not worth living. In the Netherlands in 1990, around 1,000 patients were killed without their request. The third reason is that we could never truly control it. Reports from the Netherlands, where euthanasia and physician-assisted suicide are legal, reveal that the doctors do not always report it. The fourth reason is that the assumption that patients should have the right to die would impose on doctors' duty to kill. This is restricting the autonomy of the doctor. Also, the right to die for some people might well become a duty to die by others, particularly those who are vulnerable or dependent upon others. Points that may encourage someone to decide euthanasia are moral pressure on the elderly relatives by selfish families, moral pressure to free up medical resources, and then patients who are abandoned by their families may feel euthanasia is the only solution. The debate is not about the right to die, it's about the right to help patients kill themselves. Instead of giving freedom to patients, euthanasia and assisted suicide is about giving other people the legal power to end another person's life. Euthanasia and assisted suicide are matters of public concern because they involve one person facilitating the death of another. Friends, relatives, and healthcare staff and society are hugely affected by the wider ramifications of this process. Changing the law to allow euthanasia or assisted suicide will inevitably put pressure on vulnerable people to end their lives for fear of being a financial, emotional, or care burden upon others. This would especially affect people who are disabled, elderly, sick, or depressed. Some would face the added risk of coercion by others who might stand to gain from their deaths. Fear and anxiety would be promoted rather than individual autonomy. Allowing euthanasia will lead to less good care for the terminally ill. Allowing euthanasia undermines the commitment of doctors and nurses to saving lives. Euthanasia may become a cost-effective way to treat the terminally ill. Allowing euthanasia will discourage the search for new cures and treatments for the terminally ill, and euthanasia undermines the motivation to provide good care for the dying and good pain relief. In Oregon, where assisted suicide was legalized in 1997, the law has led to patients doctor shopping for willing practitioners, using doctors who have minimal knowledge of their past. In 2008, 50% of patients requesting suicide were assisted to die by a doctor who had been their physician for 8 weeks or less. I believe that all life has value,